Hi, I'm Dr. Aaron Gorin of Gorin Plastic Surgery and Med Spa. Today's video blog is on liposuction. Okay, there are a few different types of liposuction that I perform. And one is the so-called traditional technique, which is simply the use of a cannula, which is essentially a stick with a hole down the middle, which sucks the fat out. Some people call this tumescent technique. The term tumescence is in relation to how we perform the procedure, which essentially is where we make a very small incision and fill up the space with fluid, which includes a little Novocaine, a little epinephrine to minimize bleeding and bruising, and a little saline. And so it stretches the fat cells out to make them easier to get pulled out. So that's the so-called traditional type of liposuction. Now the other types that I use include what's called laser-assisted liposuction. It's called laser-assisted, not laser liposuction, because it's really just assisting the traditional technique, meaning that the laser itself is a small little wire with the light on the end, which helps melt the fat as we bring it back and forth throughout the tissues. But we also need to remove that fat. So in addition to the laser itself, we also fall back on the traditional technique of actually removing the fat cells. The other technique is what's called ultrasonic assisted liposuction, which is similar to the laser, but instead uses ultrasound technology, which causes the fat cells to shake really violently and then essentially break apart, and then we pull them out with the traditional technique. This is mainly used for fibrous areas, such as the chest in guys, as well as the waist in both men and women. And then finally, there's a technique that came out a number of years ago that I've adopted that has really made essentially a sort of a game changer for me for liposuction. Not only has it made the surgery a little easier on me as a surgeon technically, but also gives me some better results and more smoother type of results. So that's called power-assisted liposuction. So this is the device. It's from a brand called Micro Air, and I will turn it on just very gently, and you can kind of see very slightly how the cannula itself tends to vibrate very gently, which allows the fat cells to essentially break apart from each other and then get sucked out at the same time. So this, I think, is a great advance in liposuction technology, and it's one that I essentially use for all cases. Each of our procedures are performed in our fully accredited surgery center under either IV sedation or awake. I prefer patients to have IV sedation because I find patients tend to tolerate the procedure much better when they're asleep without me having the concern of causing any kind of pain throughout the procedure. Now, in some patients who would rather be awake, we could certainly do that too, but I do feel that the technique is a little easier to perform with better results with the patients asleep. The recovery from this procedure is essentially between 3 and 5 days. Most patients are up back to work after about 4 days, and then exercising after about a week to 2 weeks. I look forward to seeing you in a complimentary consultation. Please contact me anytime at gorinplasticsurgery.com or at my email address, which is drgorin@gorinplasticsurgery.com. Thank you.